Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man. I had sexual relations with a woman I do intend to pursue a long-term relationship with. Yes. He said it just like that. Me. Okay. I'm assuming there was an accident or it unprotected. How long ago did it happen? Man. Last night, at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if plan B will work. Oh, me. We have this medication called Plan B, and since the incident happened within 72 hours. Man. Oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man. We're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin, minerals, food? Me. She's already taken it, which was the Plan B. There are some other options but those are prescriptions. And no, there are no over-the-counter products she can take. Man. What about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me. No sir. There isn't anything you can take now. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back. Patient provided improper specimen. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? My mom has given up on trying to get my dad to drink water during the day. All he drinks is coffee and beer, and there's water in those. He takes his meds with Guinness. His exercise consists of going from the bed to the couch and back again each day. He'll go grocery shopping and to the variety store, but he doesn't go out often. Doesn't do much housework or outdoor work. Then he wonders why he's having trouble regulating his blood sugar. But he's not someone you can reason with. In this lady's case, maybe she genuinely forgot or had trouble recognizing symptoms of thirst. I've heard of that happening. Ed. A word. Physical therapist. Had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15 to 20 cups of coffee daily. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Rural doc here. 35-year-old female walks in with right-sided jaw, neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later. Oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry I forgot to mention that. A friend of my mother's died from a wasp that got into his drink. He swallowed it, it stung him on its way down, and despite having no allergy to stings, the swelling was enough to close off his airway. Okay, new fear unlocked. I am already paranoid about bugs going into a drink can, and I won't drink anything I left unattended a while, but that's just awful. Edit. Tons of replies. Just want to say I'm even more horrified now. This is not as rare as I thought. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. I'm a social worker, and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away, and she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child, and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Working midnight in the family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them. Ask him, the 4-year-old. He said he needed to see a doctor. Me. Did he say anything was wrong? Them. No. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the at 2 a.m., purely because the 4-year-old said he needed to see a doctor and they don't know why. Meet a child. Why do you need to see a doctor? Kid. The doctor has suckers. Me. To be clear, it is the parents who lack sense and not the kid. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an Apoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Had an 18 or 19-year-old girl come in my with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers, every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist, arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker leads still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." 1 award. I am a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India, that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained, because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. Me. What brings you here today? P. Doc, my right hand fingernails keep getting yellow discolored. Me. Only right hand. P. Yes, and only after meals. Me. Do you eat with your hands? P. Yes, always. Me. So, you know it's just turmeric, right? P. Yes, but can you make it stop happening? Me. For God's sake, use a spoon. P. So you mean there is no medicine to make it stop? Me. P. Me. No. This might hit home more with people of South Asian cultures or people who habitually eat turmeric-cooked food with their hands. Anyway, for a grown-ass person to complain of this was just, well, surprising and a little ridiculous. Saw a chart once where a person came in for a burn to their eye. They told the drive they read online that warm milk in the eye can help with irritation and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. M's here. Had a diabetic in his 30 to 40s who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar as only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice seam I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. I work in veterinary medicine and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian. Their breeder, their relatives, their lawn mower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for GI upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. This was one of the funniest yet cutest one, was a student doing a shift in andrology reproductive health. Doc. So you're trying to have kids but not managing to. So do you have any other kid? Patient. Yes doc, I have one. Doc. Okay, so we need to do this and that. Patient. Okay, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocked the door again saying, "Hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me, I always considered my own son." This happened in med school on my OB/GYN rotation. Patient: "Who's the baby gonna look like?" Me: "What do you mean?" Patient: "Well, is it gonna look like the dude who got pregnant or the guy who's been nutting in me the last few months?" Me: "Utterly speechless, the baby should look like the people who conceived it." This person is now a parent. Edit. Fixed a typo. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. When doing a medical resupply in Iraq, one of my dudes lost a cooler of rocuronium. A whole flat of vials just, somewhere in Iraq. Rocuronium isn't a fun drug. It's a paralytic. You just stop breathing, completely awake and aware of what's going on around you. Anybody remember the Vanderbilt med error? Similar drug, vicuronium instead of rock, both non-depolarizing neuromuscular blockers. We all just waited for news of some soldiers or Iraqis dying mysteriously after sampling the rock but never heard anything. I feel this. Had a patient who we helped get access to home oxygen privately because his respiratory specialist wouldn't sign off on it because he wouldn't quit smoking. Patient was very indignant about it because he insisted that he had totally quit smoking for realsies and hadn't smoked for 4 months. Got a call from a nurse in emergency a few weeks after letting me know had come in with facial burns under similar circumstances. Doctor here. The description always makes it sound like some freak accident that couldn't possibly happen with any notable frequency, but it does. If you smoke on oxygen, the chances of igniting it are very high. We've even had to have security remove people from hospital property because they figure they will smoke with their oxygen tank outside of the main hospital entrance. It's not just a high risk for them, but also a high risk for everyone around them. Some light Googling will reveal tons of times that people have burnt down half of their apartment complex and killed a lot of other people. An oxygen tank is ironically an IED that you carry around with you to stay alive. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. Vet med here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc. and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the med. Nope, they stopped it cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note. 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis." And I didn't use any drugs. Then I smelled iron in the air and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside Out M's fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Christ, I fix medical equipment, and the amount of shit that happens because it's in the way, or otherwise inconvenient, is exactly why I drink at night. I work in a totally different field with drying equipment for floods, and the amount of people who shut the fans off due to noise then call to complain why it's taking so long is a normal occurrence. This is the type of thing that makes me understand that I'm not cut out to go into medicine. I wouldn't be able to deal with that kind of idiocy without flipping my shit the 3rd or 4th time they did it.